well, welcome everybody. So I'm excited to, I guess I should start by just mentioning who I am. My name is Delise Hector, and I'm project manager for one of the local immigration partnerships here in the province. We're called Prairie Skies Integration Network, and we're in the Moose Jaw region. So I'm really excited to have people joining us from across Saskatchewan, from various treaty territories. These areas are Treaty 2, Treaty 4, from which I join you, Treaty 5, and Treaty 6 territory. These areas are the traditional gathering lands of 31 Indigenous peoples and the homeland of the Métis. We also welcome anybody joining us from even farther away. We respect and honor the treaties that were made on all territories. We acknowledge our history and the harms committed against Canada's Indigenous people. We're committed to moving forward in partnership in the spirit of reconciliation and collaboration. We are all treaty people. I also recognize that this land acknowledgement doesn't replace my obligation to work to decolonize my daily life and practices. It is a first step on my journey of learning the truth and working towards reconciliation. Because we're focusing on the topic of health today, I want to take a moment to simply remind us of the 7 calls to action relating to health outlined by the Truth and Reconciliation Commission. These are: recognize and implement healthcare rights of Indigenous people, establish measurable goals to identify and close health gaps, address distinct needs of Métis, Inuit, and off-reserve First Nations, provide ongoing funding for existing and new Aboriginal health centres, recognize the value of Indigenous healing practices and use them in the health system, increase the hiring and retention of Indigenous healthcare workers, and finally, all students should take a course in Indigenous culture and awareness training. Thank you all for taking a moment to reflect with me on areas where we can dedicate our energies to make reconciliation tangible in our lives. And we'll just put some information in the chat for you to learn more if you'd like to. So thank you so much for your time this morning, and thank you for joining us for this event. And I'm going to now hand it over to Dina, who will take us through some housekeeping.
Good afternoon, everyone. My name is Dina Bahe, and I'm the coordinator for the Southwest Saskatchewan Immigration Partnership. We would just like to remind everyone of some housekeeping guidelines. Number one, as you might be aware already, this event is being recorded. If you prefer not to be recorded, please keep your camera off and or change your screen name. Those who do not mind, we invite you to keep your cameras on and rename to reflect your organization, if possible. For example, Dina Bahe SSIP. So what I'm going to do now is I'm going to go to my frame with the 3 little dots there. I'm going to click it and I'm going to choose rename and then put my organization SSIP. And then there's my change. Also, we would like to request everyone to remain muted when not speaking. We request that you please hold any verbal questions to the end. However, we welcome you to place text questions in the chat throughout the session. We'll make every effort to answer all the questions during the Q&A. Thank you.
Good afternoon, everyone. My name is Carol, and I'm the coordinator of the Regina Region Local Immigration Partnership. This afternoon, you're going to be introduced to Dr. Shela Hirani, who is going to share highlights from her research on the challenges newcomers face with breastfeeding. As mentioned by Dina, there will be time for Q&A. The session will wrap up around 3:30 p.m. Before we hear from Shela, I'll share briefly about the role of local immigration partnerships in this event. Local immigration partnerships, or LIPs, do not directly serve newcomers, but rather we play a facilitative role in the community, strengthening and supporting the community's efforts to welcome, settle, and integrate newcomers. Some of the work we do includes supporting community-level research and strategic planning to improve coordination and effectiveness of services for newcomers. I'll quickly introduce members of the Sask Lip RIF network that support a number of Saskatchewan communities. As I share their name, I'll ask that each coordinator give us a wave. The Humboldt Region Local Immigration Partnership, Eilish. The Southwest Saskatchewan Immigration Partnership, Tina. Prairie Skies Integration Network, Moose Jaw Region LIP, Delise and Jide. And the Immigration Partnership Saskatoon, Jasmine. And the I hope I don't make this difficult. Réseau on Immigration Francophone de la Saskatchewan. So that's the RIF Sask and Ferdinand. And I'm not sure if Ferdinand is here with us today. So just to wrap it up, today our role as local immigration partnerships is to support the knowledge translation of a recent study on the barriers encountered by newcomer, immigrant, and refugee breastfeeding mothers in Saskatchewan. I'll now pass it on to Jasmine from Immigration Partnership Saskatoon to introduce the researcher. Thank you.
Thanks, Carol. Good afternoon, everyone, and thanks for joining us today. I'm going to tell you a little bit about Dr. Shela and her research. So Dr. Shela Hirani recently completed a study that explored the challenges newcomers face with breastfeeding. The objective of her research is ultimately to improve policies and programs to better support better health outcomes for immigrant and refugee mothers and their children during the transition to motherhood and or having a baby. Dr. Shela Hirani is an associate professor at the University of Regina. She is a neonatal and child health nursing professional, academician, researcher, lactation consultant, and an advocate of baby-friendly initiatives. She earned her PhD in nursing in 2019 from the University of Alberta. Her professional goal is to make a difference in the lives of marginalized women and children through her research work, leadership, and community services. Dr. Hirani is recognized by the World Health Organization as one of 100 outstanding women nurses in 2020. In 2022, she received the YWCA Nutrient Women of Distinction Award, recognizing her research and scientific pursuit for the vulnerable population. She's also the recipient of the Sigma Theta Tau International Honor Society of Nursing's Emerging Nurse Researcher Award 2020, the Vanier Canada Graduate Scholarship Award, and the Honorary Isaac Walton Killam Memorial Scholarship Award for her outstanding academic excellence, community services, leadership, and contribution for knowledge development in nursing. She is actively involved in breastfeeding, advocacy in diverse care settings, and health promotion of vulnerable women and young children who are refugees, immigrants, internally displaced, and homeless. In Canada, she is actively involved in advocating for safe spaces to remove breastfeeding barriers in a variety of public places, such as airports, shopping malls, restaurants, mothers' workplace settings, child daycare centers, hospitals, and post-secondary institutions. Dr. Hirani is actively involved in improving health equity, addressing health subsystems, programs, and policies that often negatively affect the health and well-being of marginalized and vulnerable young women and young children, especially those affected by disaster and displacement. She has established her program of research entitled Breastfeeding Advocacy Research Program, Practices, and Policies. The key goal of this program is to contribute to improving breastfeeding rates in Canada, especially among Indigenous women, refugees, immigrants, those who are homeless or displaced after a natural disaster, as well as those negatively affected by the COVID-19 pandemic. A secondary goal is to facilitate baby-friendly initiatives in hospitals and communities in Canada. Dr. Hirani is hopeful that her breastfeeding advocacy movement will develop knowledge, guide future research, and improve the well-being of breastfeeding mothers and young children in Canada and beyond. I would now like to invite Dr. Shela Hirani to speak.
Thank you so much, Jasmine, for this introduction, and I'm really thankful to Prairie Sky, who took a lead in arranging and organizing this knowledge translation event along with other LIPs. So thank you so much for inviting, and with that, I would like to share my screen. So thank you so much for the introduction. Now you already know some of the pieces on my research, my program of research. And I would say that it's my great pleasure to have the knowledge translation event or with organize in collaboration with you all, because that's something through which I really am hopeful that that's going to really make a good difference at large, not only in the healthcare settings, but also we together going to get some kind of a reflection that what are the needs of the newcomers, immigrant, and the refugee mothers overall in Saskatchewan, and specific to their healthcare and breastfeeding barriers and the relevant needs. So the topic of my today's presentation is therefore the healthcare and the breastfeeding barriers of newcomer, immigrant, and refugee mothers who are with the young children in Saskatchewan, and there are going to be some way forward that will be discussed in today's presentation. First of all, disclosures. I acknowledge that there is no actual or the potential conflict of interest. Talking about the vulnerability of the newcomer, immigrant, and the refugee mothers, I would say that these are one of those vulnerable groups who often experience the trauma, the family separation, the forced migration from one country to another, and the social disconnection in a new country. And this is for the vulnerability that we can see that once they are migrating to a new country, most of the time it's not their own choice, especially in the case of refugees who actually have went through so much of the trauma. They have they were into the situation of evacuating their home countries that they never thought of leaving, and they are migrating to a new country where they really don't know anybody. They really don't know how things gonna be similar or different from their own home countries, and therefore they are much more into the situation where really they are transitioning from their immediate settled life that was previously they were living in with their family, with their extended family members, and now there is a forced migration. In terms of the immigrant, I would say that most of the time we do see that immigrants are coming to Canada, and most of the time for immigrant it's their own choice that they really saw some better prospect in the new country and they are moving to the another country thinking that their life gonna be much more better, maybe their future generation gonna benefit from that, and then they're gonna have a better educational prospect regardless whatever the new challenges are for which they may be aware, they may not be aware. And then when they come to a new country, that's something a new another layer of the challenge to their own life. So, this vulnerability often has a negative impact on the immigrant and the refugee mothers, especially on their well being and the breastfeeding practices related to the social, emotional, psychological, and the physical stressors. No doubt, immigrant and refugee, regardless of their sex and gender, they all are prone to and they all are vulnerable to variety of the health issues, but specifically mothers with the young children, especially when they are the one who are giving the birth in a new country where they are very not much familiar with the healthcare system. Their babies are born in a new country, and many a times they don't have their own relatives there. Even like with the breastfeeding practices, like their initiation rate, their continuation rate is like even much more lesser than any other mother. And generally, if we say that breastfeeding is very, very essential for the brain development of the young babies, and that's how like baby actually establish a kind of an initial start in their life. So breastfeeding is always like the top priority that has to be taken care of whenever we say that we are taking care or caring for the women with the young children. And literature also identify that there are number of disparities that women with the young children actually face with when they are in a new country. So, speaking more on the challenging transition of the immigrant and the refugee mothers, literature identify that when they arrive in a new country, they often present with the language difficulties. They also have the inadequate insurance, health insurance coverage. And speaking for the refugee population, many times they do have a like federal kind of the insurance policies and the general insurance, but many a times they are the one who have faced more trauma, and they may need the more consultation and even like in their own languages, and at times these services are not readily available, or even if they are available they have to pay from their own pocket. And that's what something another layer of the barrier. The lack of the access to the healthcare services is another layer of barrier for them that literature identifies. Also, the inadequate breastfeeding supports for this group is also highlighted in the initial literature. So we all know that Canada is a country that each year invite the large number of immigrant and refugee families from all other parts of the world. And talking about Saskatchewan, like this province has a noticeable increase in the immigrant and the refugee families with the young children. And when we say that they are coming in with the young children, it means that it's not only that we are looking into the immediate adults of the immigrant and the refugees, but we are also looking for the future generation who gonna be in here in Canada, and we really want them to be a productive member of the society. But if the mothers are not able to breastfeed because of any reason, then in a way we are actually looking into the scenario where they are more at risk, or like their overall health or well-being is jeopardized. So, speaking more on that, most of the immigrant and refugee families who migrate to this province in Saskatchewan, they are mostly from Asia, South Asia, Africa, Europe, Middle East, Afghanistan, Eritrea, Ethiopia, Myanmar, Rwanda, Somalia, and Sudan. And we do have like more influx from other part of the world that is even commonly happening. But definitely we have the more numbers of those families that are coming in with the young children. So Saskatchewan as a whole has a noticeable increase in the immigrant and the refugee population with the young children. And unfortunately, Saskatchewan has only one healthcare facility with the baby friendly status. And when I say baby friendly status, it means that this gonna be the facility that gonna promote more of the breastfeeding and have the more supports available for the mothers who are like overall giving the birth or coming in a prenatal time for their visits. And even during the time of the birth, there are extra measures to initially have all the measures implemented so mothers can actually breastfeed well, and they can continue their breastfeeding practices until minimal 2 years. So exclusive breastfeeding until 6 months is like highly regarded because that's something very important. And when I say exclusive breastfeeding, it means that baby should only be receiving the breastfeeding and no other kind of the food or fluid, and not the juices, not the tea, or not any other kind of the cultural kind of the food that is being offered to the baby. So, when saying one healthcare facility as a baby friendly status in Saskatchewan, and along with that, there are also limited numbers of the healthcare facilities that are providing the services to the immigrant and refugee mothers with the young children. So, this whole is the greatest concern for the mothers who are with the refugee or immigrant status and they are breastfeeding their babies and would like to sustain their breastfeeding practices. So this is something that was a kind of like shock to me that, oh, that something is maybe like for the general population when it is all over limited, then how like our refugee mothers or immigrant mothers are really coping when they have a young children and really want to sustain their breastfeeding practices. So overall, few knowledge gaps that we identified, that there are the significant gaps in the knowledge surrounding the breastfeeding facilitators and the barriers to the breastfeeding practices of the immigrant and the refugee mothers who are accessing and utilizing the healthcare services in the Saskatchewan. And overall, like it's so important to explore some of their experiences and barriers so we can offer them the better supports and can provide them the need-based interventions. And when I say the need-based intervention, it's not something that what we felt as the need, but it's like what they felt as the need. And with that need assessment motive in mind, like we had the aim of the study to explore the healthcare and the breastfeeding experiences and barriers of immigrant and the refugee mothers who are accessing and utilizing the healthcare settings in Saskatchewan, Canada. So, this was a critical ethnographic study design that we employed in order to study the challenges and range of constraints. And the reason we took into account this methodology was because this methodology actually enables the researcher to look into the more underlying factors, not something on the just like a tip of the iceberg. We just see the ice on the top, and we may probably are able to see only 10 or 20% of the iceberg, but underlying factors are too many. And that was the reason we used this methodology, and in order to explore the ranges of the barrier that are actually directly as well as indirectly affecting the breastfeeding mothers who are immigrant, refugee, and newcomer in Saskatchewan, Canada. So we had a set in Saskatchewan, Canada. The data was collected via in-depth interviews, observation, and document analysis. Especially the reports that are available are the documents that we looked into in our observation, in our field observation. We looked into some of the healthcare settings, that what are the health settings available in general in Saskatchewan for the immigrant mothers and for the refugee mothers, and are they really providing any kind of the breastfeeding guidance? Are there pamphlets, their flyers, their posters that they make? Is it really catering the needs of the multicultural kind of the group of refugee and the immigrant mothers or not? So today, whatever like I'm presenting, it's a merge of the two study, because one of my study was with the immigrant group and my other study was with the refugee mothers. And in today, I'm just combining the findings from both the studies in order to give like the detailed overview that what was found in both the study, because the findings were not very much different. So we had in-depth interviews with 30 immigrant mothers from the different nationalities, and we had in-depth interviews with 27 refugee mothers who were like mainly from Syria, Eritrea, and Somalia, and having the children age 1 day to 24 month of the age. The refugee study was funded by Jim Patterson Children's Hospital Foundation, whereas my immigrant study was funded by the Saskatchewan Health Research Foundation. We had the various collaborators who really were helpful in disseminating the flyer during the recruitment phase of the study, and also supported the knowledge translation of the findings. So coming to the main findings, that what I really found when we had this data analyzed, and what we found as a first barrier was the psychosocial barrier. What we found that like almost all mom, like no, regardless they were refugee or they were immigrant or newcomer, they spoke on that they are facing the lack of social support in Saskatchewan, Canada, because Previously, they were living with their extended family members, and now they don't have anybody around them who can actually provide them the informational or tangible support towards their breastfeeding practices. Mothers spoke about that there are various socio-cultural constraints. They really don't know even who their neighbors are, and it's hard to find their own cultural group most of the time when they are newcomers, because they are not in touch with many people who can really be the good friends or just like their own extended family members whom they can share their stressors or can ventilate their feelings. They also shared that many a times, like if they are wearing their cultural dresses, people look at them in a different way. And even like moms who were breastfeeding and were preferring that there should be the private space for them to breastfeed, and most of the time, like in hospitals, they were asked to breastfeed in front of like even doctors who were males or male nurses, and that was not something in accordance to their cultural preference or like something that they really wanted to do, or like we were or very comfortable to go ahead with. So mothers also shared that there were many other economic challenges as well, and moms specifically mentioned that when they are in a new country, they don't have the very good jobs and they are not having very good financial support from the government. As a result of which, they have a limited kind of income available. And when they go to the grocery, they are not able to purchase all those food that are like of high quality or either like they are healthy. Moms specifically who were breastfeeding moms mentioned that they are not eating well actually because there is a financial constraint and they have other kids to look after, they have husband to look after, and probably they are the one who are thinking that they have to pay the rent, the bills, they have to get a car, they have to look after the transportation, they have to look after the clothing, the winter clothing specifically that are quite expensive. So moms mentioned that when it comes to food, they are eating less. And when they are eating less, they are like feeling more fatigue and they are like facing more difficulty to breastfeed the babies with that fatigue and with the hunger state or like with the long lasting kind of the food that they are eating is not something that much nutritious for them to support their breastfeeding practices. One of the participants' perspective, as she shared, as I quote, as an immigrant, we always miss our family to be around us, to emotionally support us. For me, I was tired psychologically more than physically. I needed psychological support so much, unquote. So here mom's like feelings are reflected that she really wanted someone to psychological support her during the time when they are giving birth to baby in a new country. And they all the time recall their own home country where they were having their mothers-in-law available, sister-in-law, sisters who were like supporting. Even the neighborhood or their community programs were such that they were like encouraging more mothers to be around them and then provide them some kind of a peer related support. Another barrier that we identified was the maternal and child related barrier. So in this, moms mentioned that the labor and delivery experience in the new country was really, really challenging because this was the time when they had nobody around them and they were not very much familiar with the healthcare organizations protocol and how things gonna be, and even nobody was allowed and they only had the husband available who was taking care of the other kids at home. So they were all alone going through the labor and delivery experience. And I recall the experience of one mom who was not actually knowing the language, and she had her sixth baby delivered and she was asked to sign a form, and she signed that form without knowing that what exactly it is. The next day after her childbirth, she was taken to the operation theater, and later she came to know that this mini procedure was actually her tubal ligation. It means that she would not be able to give birth anymore, and whatever the healthcare providers and her sponsor believe that she has already gave birth to her sixth baby, so it's not wise to let her continue with the childbirth in future. And when she identified that, she said that like my labor and delivery trauma itself was so much for me to handle with all alone in a new country without knowing the language. And when I came to know that I won't be able to be a mother because now this procedure, permanent kind of a family planning procedure, has been done on me. So that was an add-on kind of a trauma. And this mom literally went into the postnatal depression, not able to breastfeed her child at all because she used to see the new event at the new arrival of the baby with some add-on kind of the trauma introduced in the healthcare settings to that mother. Mothers also shared that sometimes like they are feeling the shy to breastfeed in public or in hospitals or in front of other people, and especially they are at times hesitant to ask the questions on breastfeeding, and especially if it's a male healthcare professional. So they also reflected that maybe like I was shy, I was hesitant, or I didn't know English, and that's why I wasn't able to get the related support from the healthcare providers. So many times I noticed in here that in their characteristics, there was some kind of that they were blaming, they were self blaming themselves, and that might not be the kind of the reasonable thing because at times like they were not able to breastfeed, so they were feeling guilty, and they at times were trying to cope by self blaming. So that was something I really felt that that was not healthy for them because that was not their kind of the like mistake to be in here. And sometimes like they felt that their culture do not allow them to openly speak on breastfeeding, especially with strangers and especially with healthcare providers who are males. Moms also mentioned that like when they faced so many barriers, they were nobody at times to support them to the breastfeeding to sustain their breastfeeding practices. So many moms actually face the physiological challenges including the breast engorgement and nipple sores, and when they got those engorgement and nipple sores they were not able to seek the help because many of them were not knowing English very well, and many were hesitant, and many didn't receive the support as such. So many moms actually ended up into the breast abscess, and that scenario also led them to stop breastfeeding practices, thinking that their engorged breast milk may be dangerous for their baby. And here, a few moms also spoke on their child's health and characteristics. We had many immigrant and refugee mothers who had the babies with some kind of the congenital heart disease, and with that heart defects and some disability was some kind of the add-on layer of the challenges for them, and they really felt that I don't know that how to feed this baby very well because that moms who spoke on those challenges were not actually receiving some kind of the add-on guidance from the healthcare providers at the time of the delivery and labor and even afterwards. So one of the participants quote I would like to share in here. So as I quote, the pressure we live under here in Canada is much more than we can handle. If my oldest kids were young, it would have been way harder on me. The pain after the surgery, my premature born baby, my sick daughter, and other responsibilities all was so much to handle at the same time. Unquote. So here we get to know that mothers were really struggling with lots and lots of other stressors. Many moms mentioned that when they were going for their labor and delivery, they had to keep their young kids at home while their husbands were on job. And all their young kids were actually under 10 year of age. And they really knew that province do not require them to keep the young babies at home, but they had no other choice because they had no social support from anybody. And even they mentioned that daycares were either very expensive or like they were not having the enough spaces to accommodate their babies who were at home. So coming to the another barrier, that is the healthcare barrier, and I would say that this was the topmost kind of the barrier that mothers reported on in general. And many moms mentioned that they have the lack of access to the healthcare like providers or to the healthcare settings. Because maybe their hospitals where they get the treatment from, or the healthcare settings or the clinics where they get most of the time get themselves checked is so far from their housing, And most of the time, mothers were living in the housing that were like far away from the city places, because they were looking for more affordable and cheaper housing based on their financial constraints. And they really felt that they were not that much accessible as they really expected it to be. Many moms mentioned that they have no transportation availability. They don't have their own private transportation, and most of the time they are reliant on the public transportation, even especially the public buses. And when they have the like their other younger kids with them, it's so hard to get into the buses during the winter time and reach to the hospital, and taking some walk from that type of the scenario. And even they mentioned that they lack the healthcare support. Most of the time there is no follow-up care. And also they spoke on the poor quality maternal child and mother baby care in the hospitals, because those moms mentioned that we didn't receive any kind of support in terms of like when the baby was having a congenital defect and how to feed, how much safe it is to feed the baby with the neurological deformity, and what other measures they should take. They also spoke on the lack of the interpretation services and hospital violation of the breastfeeding guidelines. In this regard, mom spoke on that they were offered the formula milk whenever the baby was crying. And even they shared that when the healthcare professionals initially used to ask them that, do you want to breastfeed or formula feed? And many times mom used to think that maybe formula feed is better at this time, and that's the reason I'm getting this option from the nurses and doctors. Moms also spoke on the lack of encouragement from the healthcare providers to sustain their breastfeeding practices. They also shared that the inadequate knowledge of the healthcare providers was another barrier that they faced. Moms shared that whenever they tried to ask the question on something, they didn't receive the right kind of the need-based answer from the healthcare providers. That was another layer of the concern that they faced with. They really thought that if they would have received the right guidance at right time, things would have been different for them and their babies. They also shared that there was a lack of access to the breastfeeding counseling facilities. Most of those were not freely available, or if they were available, they were not offering the services in the different languages. So it was so hard to reach to the site where there were lactation consultants available, because they didn't receive any kind of the more info that where their addresses are and how they can approach them. And if they go there, then it's gonna be the free consultation or the paid consultation. And right now they said that they approach few people and they said that you have to pay this much dollar per hour for the lactation consultant kind of the counseling. So they mentioned that it was so difficult based on their financial needs that they couldn't avail those services whenever it was not free of charge, and not providing the services with the interpreters. They also shared that there was no privacy to breastfeed in the healthcare settings. So, especially in the hospital environment, they really wanted to breastfeed, but there were 4 or 5 other hospital beds in the same room where mothers were admitted, and it was so difficult for them to breastfeed in front of so many people, visitor and health staff who were there around. So here I would like to share one of the participants' quote, as I quote: "In hospital, the healthcare provider asked me, 'Do you want to breastfeed or give him, the infant, the formula?' I said breastfeeding, but no one gave me any good idea about why to breastfeed, or is it good to breastfeed? The healthcare provider offer formula if mothers don't breastfeed or don't have enough milk." Unquote. So this quote itself is an indicator, like if the trained healthcare providers would have like invested more kind of the efforts in helping the mother to regain the breastfeeding supply by looking into the root cause of the problem. But like to what extent like healthcare professionals were able to give time to the mother and have that need identified for the mother, or let her to be giving her the option of feeding the formula would be the main case. So here mothers also identified few other pointers. in the healthcare barriers. They shared that there was a lack of follow-up care and insufficient community-based healthcare services, especially during the time of the COVID-19. Because since this study took place during the time of COVID-19, many mothers were not having the visits from the nurses and healthcare providers who could provide them the better supports on their breastfeeding practices. Apart from that, another important highlight from the finding in both the studies was that mothers reported there is a racism in the healthcare settings. Many times that the way they are being dealt with or are ignored or neglected, that's something really bothers overall their health and well-being. They also shared that there is a lack of the cultural sensitivity in the healthcare settings, especially they are being served the food as a new mom when they delivered the baby. So in the postnatal suite, when they are admitted, they get the food which is not even culturally appropriate. And here, moms identified, like especially those who were Muslims, and eating pork and bacon is something which is like really prohibited. So they said and mentioned very clearly that despite of mentioning that they are Muslim mothers and they only eat halal food, they were offered the pork and bacon sandwiches in the hospital, and that was something that was keeping them away to eat anything in the hospital after the childbirth. And this was causing more pain and more kind of the fatigue in the mothers and couldn't breastfeed at that time. Also, moms spoke on that the food quantity that they receive in the hospital is something not adequate for based on the calorie requirement of the breastfeeding mothers. And here I would like to share a quote from a mom as I quote, I couldn't eat the food that was provided in the hospital. The food wasn't halal. At the beginning, they asked me to write my dietary restrictions. I told them, I do not eat pork, no meat or chicken for me. They didn't offer halal food. My husband or my friend bought me food. I only ate the breakfast in the hospital, unquote. So this quote is the reflective of the challenges that many moms actually went through in the hospital settings. Here I would like to share another quote and very powerful quote that really gives the very clear picture of the lack of cultural sensitivity in the healthcare settings that they faced with. As I quote, some nurses were very welcoming, but others were not very friendly and they would be unhappy if I asked them questions. Sometimes I used to take my elder daughter with me because her English is better than mine. One nurse refused to answer my daughter's question and told my daughter, it is not your business to know. I have told your mother the situation. And if she didn't understand it, it is not my problem. As a migrant mother, I suffered at the beginning. I was so sad and embarrassed, unquote. So this quote itself reflects that at times, like if there is no interpretation service in the hospital, that can be an issue. And simultaneously, it's so important. The communication element is so important between a healthcare provider and the patients, and especially in terms of the breastfeeding mothers, they are more vulnerable because if they are feeding the formula, are they really knowing that what are the risks involved in feeding the formula? Most of the time, we dissolve the formula in a water. Is it a safe water? Is it a clean water? And how about like the bottles and the teats that are being used, are they really regularly sterilized or not? And that's something which is not very ideal for the babies because the formula milk is not having any antibodies. The formula milk is not something that highly nutritious as breast milk is. Formula milk is actually enhancing babies' risk to have the dental caries or the malalignments, and even their gut is at the very high risk. They can get the diarrhea if there is some infectious kind of the agent introduced during the preparation phase. And even the powder milk itself is not highly clean because they are drying up the cow's milk, and that's what the formula milk is. At times formula milk says that that's a substitute, that's a mimicking the breast milk, which is not the case. So here it's so important to give the mothers, the breastfeeding mothers, the need-based guidance so they are not actually getting into the trap of the formula things, which is equally expensive as well. And with all the financial difficulties, it's not something a feasible option we can look for the families. who can actually breastfeed and actually can actually regain the breast milk supply with some kind of the add-on support. Apart from all the healthcare barriers that I shared and found in this study, there were many environmental barriers that women spoke on, and they especially they shared that the COVID-19 pandemic was really hard on them because they were not able to book an appointment with anybody. They were not able to go to the healthcare settings to share their breastfeeding concerns. They even shared that during the time of pandemic only those patients were allowed who were like having any immediate injury or heart attack or any kind of the life threatening kind of the issue. So if they were trying to go to the healthcare setting to seek any support for their breast engorgement or nipple crack, then they were sent back home saying that this is COVID-19, you don't have the heart attack, you don't have any life threatening kind of a situation, so breast engorgement is not one of the priority. You may go back home. So that's what mom mentioned about. And even during the time of pandemic where there were more telephonic kind of the conversation and consultation, many moms were not able to get the telephonic appointment for the doctors because they mentioned that either their English was not good or they were not very comfortable in sharing those kind of the concern. And something with the breast, as I'm a lactation consultant myself, I know that many times you need the face to face or some picture based presentation in front of you to be able to diagnose and solve the concerns of mom. Apart from that, moms also mentioned that few other environmental barriers included the climate and the geopolitical factors, especially the cold weather, for which they were not very used to of, the winter, the exposure to the war and displacement as a past trauma were all combined kind of the add-on stressor for them that were actually directly or indirectly affecting their breastfeeding practices. So here I would like to share two of the quotes from the mothers as I quote. I am tired, scared of COVID. I'm also depressed since there is no socialization anymore, unquote. Another mom shared, as I quote, with COVID 19, I think it changed life in itself. Especially during the lockdown times, we are not able to see doctors as easily because of the fear of going to the hospital, unquote. So here, like the add-on kind of the concern that mothers voiced out like were really affecting their breastfeeding practices. The other theme from our study was on the environmental barrier. Mothers mentioned that at times there is a non acceptability of breastfeeding in public, especially the immigrant mothers. They shared that in their home country, at times it was so easy to breastfeed wherever they felt like to breastfeed. But here, like in variety of the public spot, like airport, in shopping malls, there were no private spaces that they were able to to get into and get their breastfeeding done at that time. So they really shared that whenever they tried to breastfeed in the airports or even in the restaurants, they were asked that please cover up or use the washrooms. And washrooms are not that much hygienic kind of the option to breastfeed the baby. So they were really like into that feeling that I'm not a mom who really support formula milk and formula is not good for my baby, but there are no spaces and I cannot remain isolated in my own shell or in my own house. So these were like few add-on concerns, and women really recommended that there should be the breastfeeding acceptance in all public places, including the hospitals, workplace, airports, restaurants, public parks, and the public transportations. Mothers who were like employed and immigrant mothers especially, and they mentioned that their workplace, the nature of the workplace is such that doesn't allow or support their breastfeeding practices. Many moms, especially refugee and immigrant, initially they said that they are having the financial instability in home and they are really trying to meet the ends meet by supporting their spouse or by their own self. They are trying to join some employment based on the financial instability and to better support their household. But when they go to the workplace, they don't have any support from their employers or colleagues. There is no private space to breastfeed the babies or to pump or express the breast milk and store it while they are at work. And there is also the lack of flexibility in general for mothers who are breastfeeding practices. and there is no time to breastfeed. I know that most of you would be thinking that how about the maternity leaves? So most of the participants mentioned that since they are working part-time or on the casual basis, so they are not actually entitled to the maternity leaves or any other leaves, and they are the one who really have to sustain their breastfeeding, but many times they couldn't, and just to join the employment and fulfill all those requirements and meet their financial kind of the constraint to overcome with, they are just trying to stop breastfeeding and go to the workplace to help their and financially support their own family. So all those barriers were too many. They were ranging from psychosocial to healthcare, environmental, workplace, and all those kind of the barriers actually give us an idea and thought that mothers who are immigrant, newcomers, and refugees, they are not only facing one stressor to be a refugee, immigrant, or newcomer. They are having many other add-on kind of the stressor because of the number of barriers. So here are a few recommendations that we came up with the proposal with, and the first recommendation is that it is essential to involve the immigrant and the refugee mothers and their family members as a partner in designing the innovative and need-based programs that can promote, protect, and support the breastfeeding practices of the refugee mothers. And here I would say that many times, the programs are designed, the policies are designed, to what extent we are really taking the say or the perspective of those mothers who are really the immigrant, refugees, and newcomers. So it's so important to involve them in designing those interventions. And few other recommendation includes that the breastfeeding practices of the immigrant, newcomer, and the refugee mothers can be promoted through the healthcare support, the culturally appropriate services, interpretation services in the healthcare settings, implementation of the baby friendly initiatives, hospital and community based breastfeeding campaign, as well as the follow up services. Also, it is recommended that the healthcare providers and in general, we should use the social media, the helplines, and telehealth facilities should be there to provide the need-based support and breastfeeding counseling to the immigrant and the refugee mothers in their preferred languages, so that they are having a kind of a forum where they can share openly their concerns. There should be some peer support counseling group that could be made, and mothers could be put into those groups to support each other, especially the experienced mother supporting the other mother. And again, there should be something, the online mode as well for the mothers that they can avail with. And during the time of pandemic, when mothers were having no kind of such supports, they really felt that they were not able to seek any kind of the help and sustain their breastfeeding practices and faced more challenges. And also, the recommendation is that there should be the partnerships and collaborative efforts by the interdisciplinary professionals, governmental and non governmental organizations. And this is recommended to extend the social support, facilitate the resilience building, promote the health, build the capacity of the immigrant and refugee mothers with the young children. So, breastfeeding is not something that promotion is not only the responsibility of the healthcare providers, but it's the shared responsibility that everybody share, because we are offering the more environmental supports, we are providing them more kind of the collaborative care, and that's something that gonna really help in the long run, because mothers are not only facing the healthcare barriers, the challenges are multi-layered. They are not only in the healthcare settings but also outside the healthcare settings. So how to make the mother's own self more empowered by the different kind of the supports made available in the different layers of the environment that mothers are into it. So here I would like to share one knowledge translation video, and I would just play them one by one. So the first one is actually on the knowledge translation video on the refugee mothers' healthcare barriers and the breastfeeding barriers. So let's watch it together.
This video presents the challenges and breastfeeding experiences of refugee mothers accessing and utilizing healthcare services in Saskatchewan, Canada. Dr. Shela Hirani and her team acknowledge the support of Jim Pattison Children's Hospital Foundation that funded this study. I am a refugee mother with a young child who is accessing and utilizing healthcare services in Saskatchewan, Canada. Let me share my journey and challenges that I face as a breastfeeding mother. The journey from home to hospital is not easy. I wish there were childcare support or babysitting facilities in my community or hospital. It is challenging to access healthcare settings. I don't have my own transportation, so I have to call an ambulance whenever I need it. Use of ambulance service requires a lot of time and money. In a healthcare setting, most of the time people don't understand my language. It is very frustrating for me. I appreciate the support of nurses and doctors, but I wish they were more interpreters so I can explain my healthcare needs more clearly. I wish in the healthcare setting there is no racism. The stress of racism affects my health and well-being. During the time of my hospitalization, I wish hospital had some culturally appropriate food for me. In the healthcare setting, many barriers are not supportive of my breastfeeding practices. I don't have much breastfeeding support from my social network. In healthcare settings, I often don't receive need-based breastfeeding education and guidance in my language. Instead of breastfeeding counseling, I often receive formula samples in the healthcare settings. Many a times my breastfeeding practices are not supported. In healthcare settings, many a times there is no privacy to breastfeed. I feel very uncomfortable breastfeeding in front of many people. I wish there was a breastfeeding room in the healthcare settings. Before COVID-19, nurses used to visit me at my home, but not anymore. This is my story and I am not alone in this journey. There are a lot of refugee mothers who face similar barriers. We need your support to sustain our breastfeeding practices.
So here is like another video that I would like to play that's more on the healthcare barriers and some of the recommendations.
This video presents healthcare barriers experienced by breastfeeding immigrant mother in Saskatchewan, Canada. Dr. Shela Hirani and her team acknowledge the support of Saskatchewan Health Research Foundation that funded this study. We acknowledge that there is no actual or potential conflict of interest.
In healthcare settings, I feel that there is a discrimination and racism. The way healthcare providers look at you makes you feel that you are not one of them or different from them, and they deal with you differently, maybe because of your accent. They give me the feeling of neglect. Sometimes they undermine your ability to talk or have knowledge about a certain thing.
As a Muslim woman, my preferences in the healthcare setting were halal food, privacy to breastfeed, and breastfeeding counseling by the female healthcare providers. Unfortunately, my requests were not accommodated. My doctor was a male and I did not feel comfortable talking with him about my sore, cracked nipples.
During my hospital stay, the worst thing was the shared room having no privacy. There were 4 beds in a hospital room.
Due to lack of privacy, it is challenging to breastfeed, especially for a woman who has just delivered a baby. I felt that the healthcare providers in the hospitals were not encouraging. Because of this, I was about to give up on breastfeeding. I wish they were more encouraging. In healthcare settings, the healthcare providers just tell you that breastfeeding is good. But they don't know how to support you more. I felt that they have limited breastfeeding knowledge and expertise. I felt all my clinic visits were very short and all my questions were not answered. Most of the time there were no interpretation services in the healthcare settings. It would have been helpful if the healthcare providers explained me about breastfeeding and offered timely support. My baby stopped breastfeeding and I couldn't breastfeed again as I didn't get any support or guidance on breastfeeding. I often received formula samples from the doctor's office. I wanted to talk to a breastfeeding consultant, but there were no lactation consultants at the hospital. If they were available, they would make me save my milk, discover the tight tongue problem in my baby, and prevent the clogged duct from happening. Having breastfeeding advocates such as a breastfeeding consultant at the hospital is essential as they have the needed knowledge to avoid and solve problems.
Immigrant mothers recommended for the healthcare settings where there is no racism, cultural sensitivity, privacy and infrastructure for breastfeeding mothers, encouragement from the healthcare providers, availability of lactation consultant and knowledgeable healthcare providers, adequate breastfeeding support and care in different languages, and breastfeeding advocates that support baby-friendly initiatives.
We need quality healthcare and lactation support to sustain our breastfeeding practices.
So there are other knowledge translation videos. I know that I don't want to exceed the time. So probably if we need some question and answer session, then we probably have to skip it. So this is a link and I can post it into the chat as well for everybody. And there is a YouTube channel of mine having all the videos. So you are most welcome to reach out and watch those videos in your own time, highlighting some of those concerns that I presented in today's knowledge translation event. So here are some of my publications in case you would like to access the full text article. I would be more than happy to provide you, and please email me if you require some of those, identifying the challenges of the refugee mothers in Saskatchewan during the COVID, or like the on the cultural sensitivity and what are the effects of the forced displacement. I would like to acknowledge my patient partners and all other team members and acknowledge the funding from Jim Pattison Children's Hospital Foundation and Saskatchewan Health Research Foundations. I'm also very thankful to all the collaborators for their support in the recruitment phase of the study participants. Here are the references that I used in today's presentation. Here are my contact details. You are most welcome to reach out to me in case if you need the full text articles and have any other question. I do hold a YouTube channel where all those videos are available. So in case you would like to subscribe or access those videos, those are publicly available. So with that, we can have the questions from the audience.
If you have a question, can you just raise your hand using the little reaction thing, please? I have a question if no one has one at the moment. Do you find that um, breastfeeding support groups are more popular nowadays?
Yeah, they are because, like, during the time of COVID, it was mother to mother support that really helped many participants. And they shared that, like, fortunately, if they found some friend and then they were able to collaborate on and get some kind of the questions answered through those previous experiences, that was helpful. And in general, like, the literature highly support that this is something of great help to the mothers who are breastfeeding, but definitely there should be some kind of the expert guidance and some kind of the more social support avenues, that those forums are mostly from the experienced mothers to the new mother, and then the chain continues. So I would say that definitely those are so important and essential.
Awesome, thank you. Carol, go ahead.
Oh, thank you. Dr. Hirani, I was just wondering, you had mentioned the workplace barriers and wondering if the participants talked about the types of supports they did receive in their workplaces in their home countries, and wondering if that's something we can learn from here.
Yeah, definitely not at the workplace, I would say, but they said that they were more kind of the avenues, like especially like one of the mom who was from UAE. She specifically mentioned that in UAE there is more support in the hospital, especially like when they have more mothers who are like preferring to cover themselves, and they have a separate rooms everywhere, like in shopping malls and even like in the workplace settings. And even like the same kind of the avenue is being used nowadays in United States very highly. And there is a kind of the pod like mamawa pod that they are trying to install in the different parts of the airports, and then in the workplace where mothers can just unlock that mamawa pod using their app, and then they can get into their express their breast milk or feed their baby, and then that gonna be readily available for another mom to use that one. So like gradually there is some kind of a shift that is happening. And definitely like in Canada, like when I traveled recently, I did see that like there was one mamawa pod in the Vancouver airport and one available at the Toronto airport. So many such kind of the like avenues are trying to be very helpful for those mothers. And even in some of the university post-secondary universities and institutions are like really trying to get those breastfeeding room concept in the workplace, so that faculty members, staff, and students who are studying secondary can really benefit from that.
I kind of have another question.
I think Jasmine has a question, Eilish.
Oh, okay, sorry. Yeah, go ahead, Jasmine.
No worries. Dr. Hirani, so with the women that you interviewed, did any of them receive at-home visits from healthcare professionals just after giving birth?
So, like in Saskatchewan, there is a kind of a follow-up visit kind of the norm that is there inbuilt in the healthcare system, which is very good. But the problem was that during the time of COVID-19, like all the healthcare professionals were asked to help out in the hospital or in the emergency settings or in some other kind of the avenues. So they were into the COVID vaccination and testing zones and all those, so they couldn't visit the mothers at home. So that was one of the major barrier. Otherwise, this kind of the facility is so helpful.
Do you know if it's been resumed now?
Yes,
Yeah.
it's gradually, but it has not fully, because even like if they are coming, then are they really knowing the mother's language, or are there any other kind of the arrangements that are made for the interpretation services? That's something the important consideration.
Thank you.
I'll ask a question. um, you mentioned that like a lot of immigrant and refugee mothers don't really get educated on breastfeeding. Is that just a language barrier, or is that just healthcare professionals not teaching that?
So what came out from the data was that there were like the different type of the expertise level within the healthcare providers. Few were knowing about it because lactation itself is a specialization, and not all the healthcare providers are actually having that expertise or like that specialization done. But ideally, it seems that it's so important for all healthcare providers providing direct and indirect care to have that expertise so they can provide them the better services. Because since in the video there was one mom's quote that was shared that they all say breastfeeding is good, but when it comes to breastfeeding a premature baby, breastfeeding the baby with the congenital heart defect, or the breastfeeding a baby who has a neurological defect, so those kind of the nitty-gritties are important to consider too, and those expertise are actually missing in that case whenever they need the extra help. And if mother, for instance, say, I have a breast engorgement, cracked nipple, and what's the solution? And that solution is something that only those gonna be well aware of who have some kind of better training, or if they can have that type of kind of the extra layer of support could be introduced. So even healthcare providers who don't know themselves, maybe they can take the help of the senior colleagues or somebody who could be a good resource for those mother in that scenario.
Thank you. We do have a question from the chat. Is there a bill, a law, or a guideline to encourage breastfeeding and discourage the use and promotion of formulas in the hospital settings?
So as such, like those are well implemented, although like Saskatchewan website does say on the breastfeeding website that Saskatchewan is a province that encourages the breastfeeding, and every mother should breastfeed, but there are certain kind of the implementation barrier in the hospital settings in itself, because as I mentioned in the beginning of the presentation that all healthcare settings in Saskatchewan are not baby friendly. And when they don't have a baby friendly status, it means that they are not obliged to actually the one who would provide all the kind of the supports towards the breastfeeding, and they probably have they if they are breastfeeding friendly hospitals, they have the expertise, they have the supports, they have some kind of the extra system available in there. So, unfortunately, in Saskatchewan, there is only one healthcare facility with the baby friendly initiative. The other healthcare facilities are gradually getting into that situation to be a baby friendly hospital, but definitely they are trying. There is a breastfeeding friendly initiative coalition, as well as the breastfeeding committee of Saskatchewan, that is working very hard on that. We do have a like the team of the lactation consultants who are really working hard, but it's not only the one team, it's not only the one designated individuals who have to do that. It's like everybody's contribution is equally important in that implementation, including the administrator, the policy at large. The role of general public is equally important in that one as well, especially like in settings that are other than hospitals.
Thank you. There's another question. Did anyone express concern over quick discharges home after birth without the chance to get breastfeeding underway before going home?
Yes, definitely during the time of the COVID. And there was a one mother who I remember that she had a C-section, and she said that I had a C-section in the morning, and next morning I was asked to leave the hospital when I was not fully in the condition of leaving the hospital, wasn't able to walk. My stitches were extremely painful, and that was a time when I had no other option, and my baby had to be in the NICU, and her baby was born preterm and required the NICU care. And she was the one who were asked to leave as soon as possible the next day. And she said that at that time, like my house was so far away from that locality and that healthcare setting. So so that participant mentioned that her husband actually arranged a hostel room, paid for the rent for 5 days, so that she can actually regularly visit the child who was in NICU. But that was more financial implications on her because of that note.
Thank you. Does anyone else have? Oh, Dina?
Yes. Dr. Hirani, participants of your study, were they breastfeeding in their original countries, or did they just breastfeed here in Saskatchewan? Because you mentioned that some of them have children prior to the breastfeeding situation here in Saskatchewan, correct? So, what methods did they use back home?
Yeah, thank you so much for this question. So definitely, like there were few participants who were experienced mother. They had the previous babies, and they were the one who were breastfeeding, and they always acknowledged the support of their family members and friends and neighbors in the home country that made them so much equipped, as well as the healthcare providers. So they said that when they migrated to the new country and having their second child or third child or fourth child or onwards, they were more experienced mom. They were knowing how to tackle different scenarios. But I remember there was one mother who was an experienced mother. She had a prior breastfeeding experience, but she was still not able to do that because she had to join the workplace. There were no supports in that. There was another mother who had the baby with the prematurity, and the baby was in the NICU, and there was a physical separation between the mother and the baby. And there were the NICU nurses who never taught her that she had to really express the breast milk, or is it allowed or not allowed. So those storage and all those kind of the situation were add-on concern during the time of pandemic, because nothing from the outside was allowed in the hospital. And there were also some kind of the guidelines discrepancy that was going on at the same time, that mothers should breastfeed or not breastfeed. So even those experienced mother also face the challenges. And there were many new mothers, like I would say the first time mothers, who had the very first experience in a new country to give birth to a child without anybody all around and providing them the advice, or all those social support elements were absent in that case. They were having the more barriers as compared to the experienced mothers.
Awesome. Well, I think that's all the time that we have left for questions. I did notice that Dr. Shella did leave her email in the chat. So if you have any more questions, I think you can feel free to email her. And I will pass it off to Delise to wrap up.
Sure,
And
thank you so much, Eilish. And Shella, if you wanted to mention anything before I wrap up?
yeah, so in case if people would like to access the videos from the YouTube, there is a YouTube channel link that also being shared in here. So maybe I can reshare it by saying that this is something for the YouTube. Thank you so much.
Great, thank you so much, Shella. Well, before we close in just a moment, I wanted to just take the opportunity while I have some of you folks from the healthcare sector on the line to just highlight a few health-related things that us LIPS, local immigration partnerships, would like to inform you about. So the first thing is about a research project that Prairie Skies here in Moose Jaw has been working on. So we'll soon be publishing a research report produced by a team of researchers led by Miguel Sanchez and Christine Massing at the University of Regina. So it's not quite ready to be published, but it's on the current state of immigrant settlement and community newcomer integration in South Central Saskatchewan. The study explores various topics, but notably we'll soon be able to publish this section related to health. I hope participants will be comfortable with us sending out the materials via email when they're ready. We would love to be able to send them to you by email if you're comfortable with that. And you're also invited to explore the research section of our website. I think there'll be something posted in the chat in just a moment about that. And this link will refer you to the health-related findings of our previous literature review. It will make you also more familiar with the research section of our website, which we're just developing. And in the future, you will then see the present data gathering study that I referred to. You'll see here. So please feel free to have a look, and we'd love to send this information, these research materials out to you when they're ready. I really found that that was a pretty heartbreaking tale you shared, Dr. Shela, regarding the mother who underwent the sterilization procedure against her will due to her medical or her settlement team having her sign a document she really didn't understand. This is one of the most heartbreaking stories I've heard around the challenge of limited English proficiency. I wanted to just take a moment to make everybody on the call aware that there are telephone interpretation services that can be contracted to bridge this gap. And I think, Dr. Shela referred to those throughout her presentation. But I also want to let you know that in many settings, these services are already funded, they're already in place. I think SHA has access to a service of that type. So in some cases, it's really just a matter of staff being made aware that the services exist and then choosing to actually use them, which can really be related to just getting over the fear of using it the first time. I don't know if you've had that experience, but I remember distinctly being nervous about using that service. And then I tried it. And then I said, okay, why didn't I try that a lot sooner? So anyways, I would just say speak to the management at your organization to see whether that's in place and how it could be accessed, because that communicating in languages that people understand obviously can make a huge difference, as that story really pointed out to us. Another topic that's a little bit more far-flung from breastfeeding, but I just want to let you folks know about the N4 network if you don't already. And they have a training program for internationally educated health professionals. I believe it's a fully funded program. And it's called Fostering Canadian Integration for Internationally Educated Health Professionals, from Learning to Action. And N4, I'm not going to break down that acronym because I can't this moment, but it's a national network for the diversity of providers who assist newcomers in navigating the complex Canadian healthcare and social service system. So the program I'm referring to, and they have lots of other resources, but the program I'm referring to is available in both English and French. And so I'll just, I think one of our team is going to pop that into the chat for you too. And so those are the things that I have to share now, and we also have no more time for any further sharing. So at this point in time, and just let me know if it hasn't made it into the chat, but yeah, I think you'll find those materials in the chat. So if you might be able to cut and paste them and just access them once we get off this call. So anyways, that brings us to the end of today's event. And I'm so grateful to you, Dr. Shela, for being here, sharing your amazing research with this broad group of people who tuned in from across the province. I'm grateful to all of the Sask Lips and their Francophone counterpart, the RIF, for trying out this knowledge translation pilot, if you will, or just this chance to share some research that was done in our province with people who can learn and make use from it. And so thank you so much to the LIP coordinators for working with us at Prairie Skies on this, and hopefully there will be more opportunities in the future. Finally, I want to thank all the attendees. Thank you for being here. Thank you for caring about this important topic, and for going forward and seeing how you can implement the things you've learned today. So thank you to all, and have a wonderful rest of your day.